Hi, Dimitri here. Have you ever suffered an injury or gone through a surgery and your doctor physiotherapist has advised you to apply ice to the affected area? Why do they do that? They never seem to explain why you should do it, but we know that we feel better after we do it. Basically, there are two main benefits to applying ice to an affected part of your body. The first being pain management. So the cooling effect of ice acts as a numbing agent, and that reduces pain in the area, and then ice basically acts as an alternative to painkiller medications. The other main benefit is that when you apply ice along with a little bit of pressure, you can help reduce swelling and inflammation in that area, and those can be very painful sometimes. You can check out the full article titled "How Does Ice Contribute to My Recovery and Should I Use It?" on our Curvate website. Please check it out.